Hey folks, Dr. Joe Esposito here. I am so glad that you're with us today. We're having a wonderful day. Hopefully you are too. What we're going to talk about today, first part of the show, we're going to talk about your digestive system. Because the number one reason we see patients, and I've been doing this a long time, the number one reason we see patients is for pain. Back pain, neck pain, shoulder pain, headaches, numbness, tingling, car accidents. The number two reason that we see patients, by far, is the digestive system. So I can imagine that everyone listening right now can relate to what we're going to talk about today. Every one of you. Sometimes, we might talk about menstrual cramps or something. Well, half the audience can't relate. Everyone is going to have some digestive issue story. Gas, bloating, diarrhea, constipation, acid reflux, cramping. And so we're going to talk about first how the digestive system works, and then we're going to break it down for you as to what to do for each part of the digestive system to get it to work. And then if we have time later on, we're going to do a segment on what's called irritable bowel syndrome. Now, that's a generic term. Crohn's, colitis. We're going to cover a lot of these conditions, what they are. And ironically, regardless of what your diagnosis is, I'll give you a little sneak preview here. Regardless of what your diagnosis is, the treatments are almost all the same. That works real well. So that's kind of cool. So whether you're diagnosed, and sometimes you're misdiagnosed too. It might be irritable bowel syndrome, might be Crohn's, colitis. Celiac is a little different too. But the treatment is almost always the same. And so I'm going to make it real easy for you. So if you have a digestive system, you need to listen to this show. If you don't, you can tune out right now. But if you have one, you want to tune in. So the digestive system, people think about it, you say, it's just my stomach. I eat food, it goes in my stomach, it gets digested, and then it miraculously moves on from there. It's a much longer process than that. So digestion starts, when do you think digestion starts? In your mouth? How about this? It starts in your brain. And a real simple thing I want you to do right now, okay? Imagine this. If you're driving, don't close your eyes. But imagine this for a second. I've got a big, juicy lemon in front of me. Can you picture it? Really big, like the size of an orange. And I'm going to roll it on the counter. I'm going to break up the fibers in the lemon. I'm going to slice it in half, and it's really juicy. Juices are pouring out. Now, this is the tartest lemon you've ever eaten. Everybody picturing and tasting the tartest lemon you've ever eaten? What's happening? You're salivating, aren't you? Everybody is. What happens is digestion starts in your brain. When you think about food, your digestive enzymes start to flow. And the reason you're salivating is saliva, spit as you want to call it, is the beginning of your digestive system. It has something in it called salivary amylase. There's a big word. Salivary amylase breaks down carbohydrates. So that's why it's so important to chew your food. Not only to break it down and make it easier to digest and absorb, but the salivary amylase, the spit, the saliva, is beginning to break down carbohydrates. Little fun fact for you. If you ever bake something, what's usually one ingredient that goes in there that doesn't make sense? Salt, right? Always pinch of salt. Why do we put a pinch of salt in there? Salt will cause you to salivate, and the saliva being released will break down the carbohydrates and make the food taste sweeter. So that's why we add a little salt to our baking. Pretty useless information. But now you understand why the salivary amylase is so important to start that digestive process. So digestion starts in your mouth, saliva goes, breaks it down, lubricates it, and it goes down into your esophagus. That's your throat. And in the esophagus, it's a tube that connects into your stomach. Now, muscles in your esophagus contract and push the food down. And when muscles contract and push food along the way, it's called peristalsis. There's a big fancy word for you. So peristalsis helps the food move along. Your stomach breaks down food using stomach acids. Okay, so there's hydrochloric acid, and somebody sent me this question the other day on my website, and I said, well, hydrochloric acid activates, is part of the digestive process by activating the enzymes. And he came back and said, well, hydrochloric acid isn't an enzyme, it's an acid. I said, you're absolutely right. But hydrochloric acid activates pepsin, which activates pepsinogen, which then makes the food break down. And the stomach's main job is to take proteins and break them into something called amino acids. Now, the way this works is kind of cool. Proteins look like a ball of yarn. And if you take that ball of yarn and unravel it, that's what the digestive enzymes do. And as it unravels, it chops up the proteins into something called amino acids. Now, different amino acids do different things. So as a chiropractor, as a pain management expert, as an orthopedist, I'm big on the nervous system. So I keep going back to the nervous system. So the stomach breaks protein into amino acids. The amino acid tryptophan combines with vitamin B6 and creates a chemical called 5-HTP. 5-HTP now becomes serotonin in your brain. Serotonin is the neurotransmitter that makes you happy. It helps you focus. Serotonin becomes melatonin, which helps you what? Sleep. But you know, it's interesting. I've been talking about this for years, and new research out on melatonin is that it helps prevent or fight COVID. This is new research that we didn't know about. So one of the things I want to make sure you have happening in your body is a healthy digestive system. Because if the stomach is breaking proteins into amino acids and tryptophan creates 5-HTP and 5-HTP becomes serotonin, serotonin becomes melatonin, that can be part of the process that keeps your body healthy. We didn't know this years ago. We know that now. So we're discovering new things with the body every minute of every day. And there's still a lot more to discover. But the bottom line is we want the body to work as best as possible so that you're getting all these benefits that we don't even know about, that we're not going to know about for another 10 years. So if I've got healthy serotonin, melatonin production, I didn't know 5-10 years ago it was helping my immune system fight viruses. Now it is. But how do we go back to getting the body working properly? So if your digestive system isn't working, starting with the stomach, we're not breaking down proteins. Tyrosine becomes dopamine. Dopamine gives you what? Pleasure. We all want pleasure. Pleasure's awesome. But if you're not digesting your food properly, you're not breaking the proteins into amino acids to produce the neurotransmitters to give you pleasure. Now, I've been doing this a long time. I've been in practice 36 years. I've never, in my entire career, and I've seen thousands, I may even venture to say tens of thousands of patients, I've never seen somebody with an emotional disorder, anxiety, depression, bipolar, ADD, ADHD, ever not have a digestive problem. Every one of them 100% of the time. So when they come to our office, they think, well, I'm going to a chiropractor's office, I'm going to get adjusted, I'm going to feel good. And then we talk about their digestive system. And then we talk about nutrition. And their minds are blown. I had no idea that this can all be offered as part of my healthcare plan. Yes, it is. So if you're not breaking down your proteins, you're not producing neurotransmitters. Neurotransmitters are the chemicals that make your brain work. No wonder you're depressed. No wonder you're sad. No wonder you have ADD. No wonder you can't sleep. So by fixing the nervous system from a chiropractic standpoint and fixing the digestive system and getting you on good supplements, now the body is able to start to function normally and the brain essentially can reboot itself. And it's amazing. In fact, just yesterday I had a patient come in, severely depressed. Nice looking lady, in great shape, dressed very well, depressed as she can possibly be. 3 of my doctors had to go in and talk with her, myself included, to discuss what we were talking about because she was so depressed she couldn't even focus on what we were telling her. She gets her husband on the phone. Husband's a big fan of mine. He gets on the phone. We start talking. And I explained to him what we're trying to do. He says, well, she can't sleep. And I explained this whole thing to him. And he says, Doc, I've been listening to you for years. Whatever you say, I want my wife to do it. And so I'm real excited when patients like that come to us because people with neck pain, back pain, headaches, my team of doctors are really good at fixing those problems. In most cases, we can't make promises. But I consider my doctors, my opinion, some of the best in the world. And they're my doctors too. I'm their patient. So of course I want the best. But we add then the nutrition, we add the digestion, and we get in there to try to fix the cause and not just treat the symptoms. So digestion is really important, and the stomach is the key to breaking down the proteins. To move along, so I don't take up all day just on the stomach, which I could probably take about 10 hours on the stomach alone, the stomach breaks down the food, and the enzymes break down the proteins, and then it's passed into your small intestine. And in the small intestine, it's very acidic, the stomach contents. When it goes into the small intestine, if that acid was left alone, it would eat a hole in your small intestine. And we call that an ulcer. So why doesn't the stomach acid, which is strong enough to literally burn a hole in a carpet, if you were to dump it on a carpet, not burn a hole in the small intestine? Your pancreas kicks in. Now, most people think pancreas and they think, well, that's diabetes and insulin. Pancreas does a lot more than that. The pancreas releases essentially baking soda. And it squirts baking soda into the small intestine, right where the stomach meets it, and it neutralizes those acids. If the pancreas isn't working properly, you're not neutralizing the stomach acid properly, you've got problems. So now the pancreas dumps that in, and now the mouth started breaking down carbohydrates. The stomach breaks down proteins. We got to start talking about fats now, too, the 3 what's called macronutrients. The pancreas releases a chemical called lipase that breaks down the fats. So far, what have we done? We've had one place for carbohydrates, fats, and proteins to be broken down. The body is so darn smart. It has 2 places to break each one of those down. So now here comes your pancreas again, and the pancreas releases other chemicals, lipase and amylase and protease, to break down carbohydrates, fats, and proteins. Then it neutralizes the acid. This is why if you get pancreatic cancer, it's so deadly. Because your pancreas is doing so many things. It's breaking down fats, carbohydrates, proteins, neutralizing acid, and what you know about, it also produces insulin to help the body absorb sugars. And so if the pancreas becomes diseased, first thing that happens is it gets bigger. Whenever an organ is damaged, the body is so brilliant it makes it bigger. And so the pancreas is now enlarged so that it can produce more of what it's producing. If it gets overworked, eventually that's when it can fail. And that's why it's so serious. You got to take care of the pancreas. So if your stomach isn't doing its job breaking down proteins, the pancreas has to step in. If the mouth isn't breaking down carbohydrates, the pancreas has to step in. If your gallbladder, didn't mention that one yet, if the gallbladder isn't producing bile to break down fats, the pancreas has to kick in. So the pancreas is the backup plan for everything. And if you're abusing your body, maybe you've had your gallbladder removed. Now, I'm not saying you shouldn't have your gallbladder removed. I'm saying try to do everything you can to not have your gallbladder removed. There are times I've sent people out for surgery. I send them out for surgery very often. And we have a referral list of doctors that we work with that are some of the best in the world. So I can't fix everything, but they can't fix everything either. And so we work as a team to co-manage our patients. And that's what's kind of cool. So if the pancreas starts to fail, you don't have a backup plan anymore. And the reason it fails is because your mouth, your stomach, or your gallbladder aren't doing their jobs. And so the pancreas has to kick in. So I don't want to get too confusing here, but it's really important that we keep it working properly. And the way we do that is really easy. We stop abusing it. Stop putting food in your body that's so hard to digest, because that puts strain on all these organs. So I call them the 7 deadly sins. These are the 7 foods I suggest you cut back or cut out of your diet. You know what they are, right? If you're a regular listener, say them with me. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, if you're a new listener, you said to yourself, but Dr. Joe, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener is my whole diet. That's all I ever eat is alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I can't survive on anything less than that. Yes, you can. I'm guessing there's about 120,000 other foods that you can eat aside from alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And when you start switching those foods out, now, here's the thing. You have to eat anyway. You might as well eat good food. Why are you putting these bad foods in your body? One reason. Why would you put bad food in your body? It tastes good. I was normal once. Been about 35 years. But I was normal once. And I used to eat the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And they taste good. I know that. But here's the thing. Once I understood what they were doing to my digestive system and my overall health, I made a decision. And here's a decision I want you to consider. Next time you put any food in your body, I want you to ask yourself this question. Is it worth it? Is it worth it? Is it worth going out and getting drunk? Well, then go out and get drunk. Absolutely. But the more you know about what these things do to your body, the better off you're going to be. And so that's why I strongly advise that you consider every meal that you eat. And I joke, I said, if I would eat it, you can eat it. How about that? But think about every meal you eat. Is this going to be good for me or is this going to be bad for me? And if it's not good for you, don't eat it. Now, as I'm getting older, there's something I do. Whenever I eat a meal that's cooked, now I don't eat animal products. I've been vegan now for 35 years. I'm not asking you to do that. Don't worry about that. But I don't eat animal products. But if I do eat an animal product, I would make sure it's organic. Because 30 years ago, we didn't have to worry about steroids and hormones and chemicals and pesticides and all these other processes that are going on with the food. If it's organic, or don't eat it. Now, I prefer you don't eat it. But here's the thing that I do. Whenever I eat a cooked meal, so whether it's broccoli or cucumbers or tomatoes or soup, I always take a digestive enzyme. because the enzymes that we just talked about, how the whole digestive system works, is dropping. The production is dropping as I'm getting older. And so what I try to do is I try to fight the battle and stay younger. Most people think I'm 20 years younger than I am. That's pretty darn good. 20 years younger. That means I'm going to live 20 years more than the average person. I got to start making younger friends. So my friends are going to leave me here. Okay. So I got to start hanging out with younger people because my older friend, a lot of my friends do what I say, but some don't. But here's the thing. I don't not hang out with somebody or not befriend somebody because of that. I just say, I'm going to live this life. And if they want to follow along, great. If they don't, that's okay. I'm still friends with them. But I want you to understand that when you start living this lifestyle, people will follow you. What are you doing? Oh, I'm going to have a salad today for lunch. Really? How come? Well, let me explain it to you. Real quick, you don't have to be annoying. Some people can be annoying when it comes to nutrition. And just say, that's it. Or I'll take a supplement or take an enzyme if I'm going out for food. Like my favorite cuisine is Ethiopian food. And that's all cooked. So I'll be there. I'll pop my enzymes. And, I remember a waitress one day said to my friend Tim and I, so what are you doing? I said, I take an enzyme when I eat cooked food. Oh, really? Because the enzyme is going to help break down the food more efficiently. That's going to keep me younger. I'm going to absorb the nutrition better. There's no downside. It's really cheap, too. How much are enzymes? A couple of pennies? And so if you do something as simple as that, you're going to help your digestive system. Because that's what we're talking about today, your digestive system. Take the stress off your digestive system. My other rule is I try to eat something raw at every meal. Now, when I say raw, broccoli, cucumbers, tomatoes, avocados, salad, supplement-wise, I take raw supplements. The two supplements I recommend, minimum supplements everybody should be taking as far as I'm concerned, Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're two powders. They taste great. Both of them have enzymes in them. And the Essential Source, we actually add more enzymes. And so when you take raw foods or raw supplements like Super Greens and Essential Source, that's giving you the minimum nutrients you need every single day. It's a prebiotics, probiotics, digestive enzymes, complete multivitamin. And the key ingredient in there is the enzymes. So if you're not willing to do anything else, at least take some good quality supplements. And of course, the starting point would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you've ever had your gallbladder removed, I suggest you take something called Cholacol. Now, Cholacol is made by a company called Standard Process, and I like them. They have very good products. And Cholacol helps you replace the damage that was done with your gallbladder being removed because you got to help break down those fats. And so that's something we recommend as well. Now, I wish you didn't have your gallbladder removed. Some people have to have it removed. It's diseased. If it's diseased, have it removed. Don't be foolish. We have this incredible medical knowledge in this time in our existence. Utilize that. But then I want you to ask yourself a question. Why did I have to get my gallbladder removed? And having the gallbladder removed doesn't fix the cause. It treats the symptoms. Did you eat too much animal fat? Did you have a bad diet? Did you eat a lot of processed foods? That's usually the cause of gallbladder failure. And if you could fix that, now you could not, maybe you don't have the gallbladder anymore. Okay, we got supplements to help you with that. But what else is that diet doing to my body? A lot of bad things. So that's why I suggest supplements really should be a part of everybody's life. I can't imagine a day going by that I don't take Super Greens and Essential Source. I take digestive enzymes with cooked foods. I take omega-3 fatty acids for brain function. People ask me a lot, how do you remember all this stuff? And I said, well, I got a good brain. I was gifted with a good brain, first of all. I could thank my parents for that. But I also take care of it. Omega-3s for brain function. Omega-3s for inflammation. That's really important. B-complex for the nervous system. Again, I'm a pain management expert. I want to make sure the nervous system is working properly. Probiotics keep my intestines healthy. 80% of my immune system is where? My intestines, yours too. Vitamin D. Unless you're out in the sun between spring, summer, and fall, 20 minutes a day, you probably need to be taking vitamin D. I have Dr. Joe's Vitamin D on the website, drjoe.com, and I take 5 drops a day. Now, all the supplements we're talking about are on the website, drjoe.com. We also have over 1,500 hours of podcasts on the website, audio and video, drjoe.com. And if you want to make an appointment to come see us, we have offices in the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. So if you have a health issue, neck pain, back pain, shoulder pain, numbness, tingling, if you've ever been in a car accident, I was at the studio the other day, one of my coworkers got in a car accident. I said, you need to come see us right away. She said, you're right. And so she's coming to see us. So ever in a car accident, if the car was damaged, you were damaged. 100% of the time in my experience. I've never seen a car damaged where the occupants weren't. So if you want to get well and stay well, that's our goal. You can go to our website, drjoe.com. You can book an appointment right online. You can see the offices, all 4 offices. Click on that, make an appointment right online. You can call us. We were charging $375 for the first visit. That was an exam, x-rays, consultation, your first chiropractic adjustment, going over the x-rays on the follow-up visit, and a complete nutrition evaluation. We've reduced that. We're going to stop that as soon as COVID is over. We've reduced that first visit to $199. So you get an exam, x-rays, consultation, first adjustment, going over your x-rays, and a complete nutrition evaluation for $199. So if you want to do that, you want to do it soon. We do accept people with all insurances. Most insurances cover our treatment. If not, we try to match your benefits. So we do accept insurance. We accept Medicare. One of the few doctors in the world left that still takes Medicare. And we have a medical division. So we have a nurse, a medical doctor, and a physician's assistant, and we can do trigger point injections. We could do PRP, which is regenerative cells from your own body put right back into your body to stimulate new growth. We can do pain management, hormone testing. We can test adrenal. We can do hair analysis for heavy metal toxicity. So whatever your health issue is, if you go to our website, drjoe.com, you'll see a drop-down tab, and you can pick the services that you want. They're all there, but make an appointment right now, and don't waste time. The reason I say that is my doctors fill up very quickly, and it kills me when I hear my staff answer the phone and say, I'm sorry, Dr. Irwin is booked that day, because you need the care, but he's booked up. So we have 6 doctors. We have 4 offices. Make the appointment as quickly as you can. That's my recommendation to you so that you can get the best care that I feel is available for your specific issues. So again, the website, drjoe.com. So we're talking today about the digestive system. Food went from the stomach into the small intestine. The pancreas kicked in. The gallbladder kicked in. If the food isn't being broken down properly, it can go into your small intestine where essentially it rots. And when it rots, it gives off gases. So all of us have gas every day. The average person passes gas about 10, 13 times a day. It was funny. I was on Dr. Oz about a year or two ago. And Dr. Oz, we had lots of time together, just he and I. We sat and talked for about a half hour, 45 minutes. The video is on my website, drjoe.com. And we started talking about the digestive system and gas. And he says, I was on the Oprah show, and I'm thinking, I've been on the show now for 2 hours. He says, I wonder if Oprah passed any gas in that time. And we start laughing, and we're having a good time. But gas is normal. That's okay. Excessive gas is the problem. So if you're excessive gas, terrible odors, these are signs that something isn't right. And that can sit in your gut and expand in your gut. So a lot of people have this bloating going on, and all we have to do is straighten out the digestive system. The stomach flattens out. They think it's the coolest thing in the world. I got a flat stomach without sit-ups. No, you got a flat stomach because you weren't poisoning yourself anymore. And so if no other reason, if you want to get a flat stomach, fix the digestive system. Now, I'm not saying don't work out, of course, but if you fix the digestive system, so many health problems go away. The gut is really the key to getting your body healthy. So if you have health issues, always consider the digestive system first. My office, we want to get the nervous system working, digestive system working, and good nutrition. If we can get those 3 things happening, nervous system, digestive system, and nutrition, most people are thrilled with the results. And the biggest complaint I get, by far, why didn't I do this sooner? Why did I wait so long to do something as simple as take a digestive enzyme? Take Dr. Joe's Super Greens, an essential source. Take vitamin D to reduce my risk of COVID by 50%. Studies out for vitamin D. So, folks, if you have any questions, if you want to make an appointment, go to my website, drjoe.com. Make your appointments right now. Make sure you follow us on social media at Dr. Joe Esposito, Facebook, Instagram, and YouTube. Folks, I'm Dr. Joe Esposito. Again, the website, drjoe.com. Tell your friends about the show. Hey folks, Dr. Joe Esposito here. So glad you're with us. Hey, listen, we were talking earlier about digestive system, and I had so much information I had to cover, and I was laughing, I had probably about, 20 pages of research that I put together, and I used 1/2 of 1 page for when we were talking about it before. So normally I like to cover a new topic, but Garrett, my producer, said, just continue on. You've got so much to cover. So we talked about the stomach and the mouth and the digestive system and the pancreas kicking in and breaking down enzymes. If you missed that show, it's on our website, drjoe.com. And we started talking about bloating and gas, and this is a big issue. Because so many people have issues with digestion and they don't know what to do. They don't know who to talk to about it. And they may go to the doctor, they'll say, here, take some pills. And I'm not against pills, please understand that. But I want to find out why something isn't working. I've always been like that. Even as a kid, I would take things apart and try to figure out why they weren't working. So it kind of parlayed into my adult life now and trying to find out why your body isn't working. So I don't take you apart, but I try to dig in a little bit and try to find out what's going on. So things that can cause bloating, you have an infection. Of course, that can do it. Irritable bowel syndrome, which I was going to cover in the next part of the show. I guess I have to save that for a whole nother show. Celiac disease, hormone changes, constipation. Celiac disease, if I don't get to it, is so easy to deal with. And the process is this. Cut out wheat. That's it. Now, we can do biopsies on you, and that's really the only true way to know if you have celiac disease. And we can do chemical blood works and see if you have C-reactive protein and inflammation in the body. But the simplest advice I can give you when it comes to nutrition, this is the easiest thing I'll ever tell you when it comes to nutrition. Cut out wheat and dairy products. Everybody. In fact, I was just on Eric Von Hessler's show, the Von Hessler Doctrine, and the producer, Jared, we talked about this on the air, so I can say it. Jared said, my sinuses are killing me with the pollen. And I said, here's a little tip for you. Cut out all wheat and all dairy products. Give it a few days, maybe give it a week. If I'm wrong, so what? You gave up wheat and dairy for a couple of days. Go back to wheat and dairy. If I'm right, which I am, then you'll understand that when you put so much strain on your immune system with wheat and dairy products, and then pollen comes in, it's just too much for your immune system to handle, and you have this blowout reaction. One of my absolute favorite people in the world is gluten intolerant, and she was at her mother's house and had 3 pieces of bread. And next day, sinuses just blew up. 2-3 days, sinus was blown up. And it's just that simple. Don't eat wheat. Don't eat dairy products. Now, there's gluten-free breads. Bread is still sugar, by the way, but if you're going to do bread, you can do gluten-free breads as a stepping stone. And dairy is easy. There's nothing in the dairy world that there isn't a substitute for now. There's whipped cream, there's milk, there's butter, there's cheese, there's ice cream. So there's nothing in the dairy world we don't have substitutes for. 35 years ago, it was a little different. Now it's really easy to do that. So cut out wheat and dairy. And I challenge everybody listening right now to do this simple little free test. You don't have to tell me what the results are either. I know what the results are. I want you to give up wheat and dairy 5 days. I'd say 2 weeks is really the ultimate test, but if you're not going to willing to give me 5 days, 2 weeks, give me 5 days. At the end of 5 days, have a couple of slices of pizza, wheat and dairy. See what happens. If you don't feel good, I was right. If there's no change, I was wrong. So what? Nothing lost. This is the best bet you'll ever take. You can only win or break even. You can never lose on this bet that I'm giving you right now. So why wouldn't you do it? Absolutely no reason why you shouldn't be doing this. So go ahead and do that and see what happens. And then when you get the results, you can send me an email and let me know. You can send me messages through the website, of course. Any messages or questions, drjoe.com. So I kind of got off on a tangent there. Sorry about that. So how do I reduce gas and bloating? Well, you can eat slow. You can take digestive enzymes. Digestive enzymes probably be the easiest thing to do because, again, as you get older, no matter how slow you eat, your still enzyme levels are dropping. So I take Dr. Joe's digestive enzyme. It's on the website, drjoe.com. So feel free to, of course, order them there. I carry them in my car. I have them in my office, have them in my house. Whenever I eat a cooked meal, pop an enzyme. Real simple. Now, sometimes you might want to eat foods that cause a lot of gas and bloating, but you may not be in a social situation where that's appropriate. Well, there's another reason to take the enzyme. Solves that problem. So the enzymes really are pretty amazing. The other thing that I find so often is that the stomach can push up against your diaphragm. And if the stomach spasms and pushes up against the diaphragm, you cannot break down your proteins. We talked earlier about how the stomach breaks down proteins. It's the stomach's job. So the food is passing from the stomach into the small intestine. It's not being broken down properly. And then it essentially rots in the gut, giving off the gases. So if you have acid reflux, heartburn, burping, gas, bloating, stomach, chest pain, trouble swallowing, sinus problems, acid can come up into your sinuses, chances are your stomach is pushed up against your diaphragm. So you might want to come see us for that. 85% of the patients that I test have this condition. 85%. Isn't that crazy? And that's my personal research that I've done. And when you take somebody's stomach and just gently adjust it or pull it down away from the diaphragm, let me tell you, they want to name their kids after you. It's crazy when you fix somebody's digestive system. Because as we talked earlier, the stomach is breaking proteins into amino acids, and amino acids become neurotransmitters, and neurotransmitters help your brain work. And the neurotransmitter serotonin, 95% of the serotonin in your body is used in your digestive system. Only 5% is used in your brain. So if you're not producing enough serotonin, and there's a shortage of serotonin, who's going to win? Your digestive system. It gets 95%, your brain only gets 5%. So if we can get the digestive system working, you can absorb the nutrients more efficiently, and you can produce better serotonin, which is going to help your digestive system work better, which will help you absorb your nutrients better, which will help your brain work better. See how everything's connected? And so if the stomach is pushed up against the diaphragm, you're not breaking down your proteins properly, you want to come see us, we can adjust or pull the stomach away from the diaphragm in most cases. And it's incredible. It's night and day. And it's not just about feeling better, you're actually healthier. And a lot of times the stomach bloating goes away. And so people like that because the stomach flattens out. I get that way. If my stomach is pushed up against my diaphragm, I just feel fat. And I eat pretty well. And I'm thinking, why do I feel fat? And I'll go through my diet. I do this all the time. I go through, what did I eat? I didn't eat bread, didn't eat dairy, of course. I don't eat dairy. I had a dairy in 35 years. Oh, I know what it is. I grab one of my doctors. Hey, Dr. Cat, fix my stomach. Hey, Dr. Irwood, fix my stomach. Pull my stomach away from the diaphragm. Almost within minutes, I feel better. Now, it took me several adjustments to get to that almost within minutes part of my life. But we work on that all the time. So if you do have an issue like that, come see us. Go to the website, drjoe.com. And we'll set you up an appointment. We'll check the nervous system, we'll check your digestive system, and we'll do a nutrition workup on you too. Now, I joke about the 7 deadly sins of nutrition. And alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, every one of them produces gas. Alcohol is a sugar. Sugar gets into the small intestine, ferments, and creates gas. Meat, that just rots in your colon. You know about that. You know, bologna gas and hot dog gas. And sugar again ferments and causes sugar. Dairy has a lot of proteins in it, specifically casein, that we don't have the enzyme called renin to break down the casein. So that causes a lot of gas and bloating. Coffee is an irritant to the bowel. Coffee irritates the bowel, and that's why a lot of people have to drink coffee to go to the bathroom in the morning. But in the process, that can cause a lot of gas. And then artificial sweeteners can cause problems too. Now, fructose, if you're doing high fructose corn syrup, or something called sorbitol, which is a natural low-calorie sweetener. But sorbitol can also break down and cause a lot of gas. So you'll find sorbitol in things like candies, chewing gum, energy bars, low-carb foods. They'll put sorbitol in it to make it taste sweet. So if you're eating these foods and you're getting real gassy, you think, okay, what's causing it? Sugar or sorbitol. So the heartburn, that's the stomach pushed up against the diaphragm. Now, people ask me all the time, they say, well, Dr. Joe, what causes it? Because again, I know what's causing your problems, but what causes the problem that's causing the problems? I find, my personal life, when I eat a big meal, the stomach pushes up into my diaphragm. And the symptom that I get, first symptom I ever get, is I can't stop eating. I just am ravenous. I just want to keep shoving food down my throat, even though I know I've had enough food. My stomach is full and it hurts, but I want to keep eating. And I believe, and I have no research on this to prove this, but knowing what I know about anatomy and physiology, my stomach is not producing something called leptin. Now, leptin is released in the blood vessel from the blood system, from the stomach, goes up into the hypothalamus and tells me that I'm full. That's how the full mechanism works in the body. The stomach empties out. Food is passed through your body. The small intestine says, hey, I got no food in here. It releases a chemical called ghrelin hormone. And ghrelin goes into the hypothalamus and tells me that I'm full. But if my stomach is up against my diaphragm, again, this is total speculation because I don't know if there's any research out there. If there is, any doctors or gastroenterologists, let me know. I'm not getting the leptin release to go into my hypothalamus because my stomach is so bloated and full. So I just want to keep eating. And when that happens, I have to step back and say, wait a minute. My stomach is not working right. Go to the office, get one of my doctors to fix my stomach. And almost instantly, the problem is solved. So I don't know. That's my symptom. And then I do burp a lot. When I start burping a lot, then I know right away my stomach is up against my diaphragm. But fixing the stomach up against the diaphragm, what is sometimes called a hiatal hernia, it's just night and day. And I don't know how to get the message across to you how important it is to get that fixed. It's vital. So if you have issues like that, heartburn, acid reflux, burping, gas, bloating, come see us. Heartburn is when you have a little burning. When it becomes gastroesophageal reflux disease, it happens at least twice a week for a few weeks. So heartburn becomes, it's just chronic heartburn basically, is called gastroesophageal reflux disease or GERD, G-E-R-D. So if you go to our website, drjoe.com, type in the word GERD, G-E-R-D, I have a real short article that I wrote about the techniques that we use to adjust the stomach. So if you want more information, it's all there. It's real easy to understand. But fixing the stomach, pulling it down away from the diaphragm is just crazy good, and it just works so well. And usually people have these symptoms worse at night because when they lay down, you don't have gravity pulling the stomach down away from the diaphragm. So that's why it's important when you start seeing these symptoms and you start seeing it at night. And a lot of you right now, I can guarantee you, at least half the people listening are saying, Dr. Joe, are you talking to me? Are you specifically mentioning me in this show? Because you just listed all the symptoms that I have. Because so many people have the same symptoms. You're not alone in the world, folks. A lot of people have these same symptoms. And so when we get in there and fix the cause, it's usually pretty cool. So symptoms of GERD or acid reflux, bad breath is one of them. And I know this because I breathe a lot around a lot of people. And when the breath smells like a bowel, it smells like a potty, that's usually the food rotting in the colon because it wasn't digested in the stomach to begin with and passed into the small intestine. And when that happens, it just rots. And the gases from the rotten food get exchanged into the blood system. They go into the lungs, they exchange again, and they come out through the breath. Every patient I've ever had or every person I've ever known in my life that has breath like that, as soon as we adjust their stomach within minutes, the problem starts to clear up. So if you have chronic bad breath, if you know somebody with chronic bad breath, that's a warning sign. It's telling you something's wrong and you want to get it fixed. It's just that simple. So don't think that bad breath is just something that's annoying. It's a warning sign. Just like pain is a warning sign. When people come into our offices, they might have neck pain, back pain, shoulder pain. Well, Dr. Joe, it really isn't that big a deal. I just take some aspirin, it goes away. The pain is telling you that there's something wrong. Don't ignore it. If you ignore it, that's when it becomes a serious issue. Bad breath is a warning sign. It's kind of like a fire alarm going off. Right now here in the studio, if a fire alarm went off, that's a warning sign. What would I do? What should I do? I'm not going to sit here and just keep doing the show. I'm going to get out. When you have pain, when you have bad breath, when you have sleep issues, you have digestive issues, those are warning signs. And you just ignore them. I don't want you to do that anymore. Stop it. If you cough a lot, that could be acid reflux coming up into the throat, hoarse or raspy voice, nausea, difficulty swallowing, sore throat, even tooth decay. The acid can come up through your esophagus into your mouth and eat away at your teeth and your gums. I cannot tell you how many dentists have referred us patients over the years and said, Dr. Joe, I listened to your show. I heard what you said about tooth decay. I got a ton of patients with tooth decay. Would you check their stomachs? 100% of them have had acid reflux. And we can take medicine to resolve the acid reflux issue, but that's treating the symptom. So you can take antacids, which neutralize the stomach acid, but that's dangerous. Why? Because you need stomach acid to break down proteins into amino acids to produce neurotransmitters to make your brain work. So if you're not breaking down the proteins properly, you got an issue. So taking the medication, again, if you have to take it, you have to take it, but there are side effects. One of them being you're not digesting your food. I would rather just simply pull the stomach away from the diaphragm and then hopefully resolve that issue. Now, it doesn't work on everybody, but a major majority of people get amazing results when we pull the stomach down away from the diaphragm. So it really is neat stuff. And again, if you go to the website, drjoe.com, just type in the word GERD, G-E-R-D, you'll see it. Now, if the acid comes up for too long, it can cause scar tissue to form, and that's called Barrett's esophagus. I don't know who Barrett was. I have a friend, Cher, who has a son named Barrett, but that's the only Barrett I know. And there's a Barrett Parkway in Atlanta, but those are the only Barretts I know. So whoever Barrett esophagus was, he got a disease named after him. So you may have to pull the stomach away from the diaphragm and then hopefully see if we can break up some of that scar tissue. Because that's advanced stages of this acid reflux. So that's not good. And ultimately, the acid can eat away at your esophagus and lead to something like esophagitis or even cancer. So it's not something you want to play with. So again, you can take H2 blockers, that's acid blockers, to prevent occasional heartburn. The problem with H2 blockers is they interfere with anti-seizure medication, blood thinners, and medications for heart rhythm. So now we got another problem. And here's the other thing, too, as I go off on a tangent here. The stomach and the digestive system controlled by something called the vagus nerve, V-A-G-U-S. It's my favorite nerve, by the way. The vagus nerve also has control over the heart. So many times when we fix somebody's digestive system, their blood pressure drops and their irregular heartbeat goes away. I had that condition for years. I didn't know what it was when I was a child. And when I finally got my stomach fixed, all my heart problems went away. Pretty cool. Okay? So it's another benefit that we can do when we fix the body and get the body working properly. So if you have acid reflux, heartburn, burping, gas, bloating, diarrhea, constipation, these are all warning signs that something's wrong. Now, we can treat just the stomach. And I have one patient, actually, and all the patients we see in all 4 of our offices, which are many, many, many patients, and she only wants her stomach adjusted. She goes to another chiropractor to get her spine adjusted because she's been going to them for years. And she says, I'm just loyal to them. I'm going to stay there. But will you adjust my stomach? Which I find silly because why don't you just let us do it all? But it's fine with me. So all the other patients, when we work on the stomach, we want to work on the spine as well. Because the way the body works, we talked about this last week, the brain is sending messages down the spine, out the nerves to every cell in the body. So the brain is telling the heart to beat, the lungs to breathe, the stomach to digest food, the prostate, the colon, the ovaries to work. Everything is happening because the brain tells it what to do. And if there's chemical interference between the brain and the body, we fix that with nutrition, hopefully. But if there's physical interference, if you have a pinched nerve, what's the first thing you think of? Well, I got pain, neck pain, back pain, shoulder pain. Those are signs that there's a pinched nerve. However, 90% of your nerves don't feel pain. Let me say that again. 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. And so in our office, we test the nerves that feel pain, but we also test the 90% that don't feel pain. And then my third concern is arthritis. If bones are out of alignment, they rub up against each other and they wear out. How often? 100% of the time. So if we can get the spine lined up properly and take the pressure off the nerves, A, you usually feel better. B, we usually open up nerves to organs so the brain can talk to the organs. And C, we slow down, stop, and sometimes slightly reverse a lot of the degenerative process. So if you have pain, if you have acid reflux, if you have headaches, numbness, tingling, sciatica, muscle weakness, folks, those are warning signs. They're telling you that something's wrong. And what would be the logical thing to do? Fix it. Don't let the fire alarm keep ringing, or don't shut it off. Find out where the fire is. If you're having symptoms, don't just shut it off. It's okay to shut it off if you need to, but then find out why. So if you want to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love the opportunity to be your doctor. So you can make an appointment right online, drjoe.com, drjoe.com. The offices are right there on the homepage, Marietta, Duluth, Stockbridge, and West Cobb. Just click on it, bring you right to our appointment calendar. You can book it right online. The initial visit was $375. We reduced that to $199. That's an exam, x-rays, consultation, first adjustment, going over the x-rays on a follow-up visit, and a complete nutrition evaluation. The nutrition evaluation alone is $150. So if we've reduced it now to help out with COVID, and COVID's going to be over soon, I hope, and then we're going to have to go back to our regular prices. I do recommend you book the appointment right away. And the reason I say that is my doctors book up very quickly. And if you want to make an appointment, you want to get in there before they book up so you can get your time slot. I tell our patients too, when you give your care plan, because after that, you're going to get a care plan. It's not just one and done, folks. So if you think you're coming in for one visit, don't waste your time and your money. It's going to take more than that. Because if we accept you as a patient, you have a problem. It's going to take time. Average treatment in our office is about 10 weeks. Not every day, of course, but about 10 weeks. And then we do maintenance. But I tell my patients, book your appointments out. Do your whole treatment plan. Book it out in advance. Because if you don't, there's a good chance that you might not be able to get the appointment you want when the time comes. And it kills me when I hear my staff say, well, I'm sorry, Dr. Cat is totally booked up. We can't get you in that day. That's why you need to be one of those people that's booking her up, or Dr. Irwin or Dr. Amy or Dr. We have a bunch of doctors. Get them booked up as quickly as possible. Because if you don't, you're going to have problems, okay? Dr. Martini's in our West Cobb office, so you can see him. You can see Dr. Cat and Dr. Pam in our Duluth office. Dr. Amy runs our Stockbridge office, and then all of them are here in the Marietta office, of course, where I am. And so if you want to make an appointment, drjoe.com. Do it very, very quickly. And of course, if you've listened to the show before, you know what I'm going to say now. If you've ever been in a car accident, if the car was damaged, you were damaged, in my experience, 100% of the time. Because I see people every single day. I was in a car accident 2 years, 5 years, 10 years ago. Now the damage has set in, scar tissue is formed, the case is closed. The insurance company doesn't care what happens to you, that you signed off on it. They're thrilled to pieces, you're gone. And now you have the residual of these injuries that you never got fixed. And sometimes it may not be fixable or maybe be able to stabilize but not improve it because it's been there for so long. So don't be one of those people that says, I wish I'd come sooner, Dr. Joe. Why did I wait? I don't know why you waited. So anyway, the website, drjoe.com. Also, if you like what you're hearing and you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. That is our podcast on all the podcast services. And you can listen to shows like this and hundreds of others. And on our website, we have over 1,500 hours of podcasts as well. The supplements that we talk about, if you have acid reflux or heartburn, please, folks, take digestive enzymes until you can get to come see us. The minimum supplements you should be taking, Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. They're on the website as well, drjoe.com. So if you're serious about wanting to get well, the nervous system has to be working properly, the digestive system has to be working properly, and you have to have good nutrition. And the website, drjoe.com, is an amazing source of information on all those issues. Type in what you're looking for in the search bar, and you'll find it. In the next couple of weeks, we're going to have a whole new website. It's going to be a lot easier to use, so just kind of keep looking out for that too. Now, we talk about acid reflux and heartburn. Sometimes it's more than that. Sometimes it's a heart attack. Sometimes it's a tumor. Sometimes it's cancer. If it hurts to swallow for more than a couple of days, you feel like you're choking and can't breathe, you have black, tarry-looking bowel movements, your mouth and throat hurt when you eat, you have difficulty speaking, swallowing foods, you vomit and it contains blood, or worse, it looks like coffee grounds. If you're throwing up something that looks like coffee grounds, get to the emergency room immediately. Might be cancer. And if you have trouble breathing, if you have numbness and shooting pain in your left arm, if you're getting dizzy, shortness of breath, anxious, that may be something you need to get to the emergency room right away. It may not be your stomach, might be your heart. Because remember, the same nerves that control the stomach control the heart. That's why when you fix the digestive system, many times the circulatory system improves, but vice versa. You may think it's the stomach when it's really the heart. So folks, I'm running out of time. If you have any questions, send them to me through the website, drjoe.com, drjoe.com. Make an appointment, drjoe.com. Want to listen to the podcast, read articles, really go down the rabbit hole on that website. We've got so much information on the website, drjoe.com. And again, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can buy your supplements online, and we can ship them to you, or you can come see us. Come to the office. Why? A, we want to say hi, and B, it's going to save you shipping costs. We're trying to keep this as affordable as possible as long as we can. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. Follow us on social media at Dr. Joe Esposito.